Welcome to my channel. Today we discuss about drug name as Clopidogrel. About is an antiplatelet medication used to reduce the risk of heart disease and stroke, a medical condition in which poor blood flow to the brain causes cell death in those at high risk. Clopidogrel is taken by mouth. Its effect starts about 2 hours after intake and lasts for 5 days. Medical uses. Clopidogrel is indicated to reduce the risk of myocardial infarction for patients with nascent elevated acute coronary syndrome (ACS), patients with cent-elevated myocardial infarction, and in recent myocardial infarction, stroke, or established peripheral arterial disease. What is an antiplatelet drug? Antiaggregant, also known as a platelet agglutination inhibitor or platelet aggregation inhibitor, is a member of a class of pharmaceuticals that decrease platelet aggregation and inhibit thrombus, colloquially called a blood clot, formation. They are effective in the arterial circulation where anticoagulants have little effect. Anticoagulants, commonly known as blood thinners, are chemical substances that prevent or reduce coagulation of blood, prolonging the clotting time. A nascent elevation myocardial infarction, NSTEMI, is a type of heart attack that usually happens when your heart's need for oxygen can't be met. And nascent elevation myocardial infarction, STEMI, is a type of heart attack that is more serious and has a greater risk of serious complications and death. It gets its name from how it mainly affects the heart's lower chambers and changes how electrical current travels through them. Peripheral arterial disease, PAD, in the legs or lower extremities is the narrowing or blockage of the vessels that carry blood from the heart to the legs. It is primarily caused by the buildup of fatty plaque in the arteries, which is called atherosclerosis. Hemostatic disorder, a group of conditions in which there is a problem with the body's blood clotting process. Non-steroidal anti-inflammatory drugs, NSAIDs, are medicines that are widely used to relieve pain, reduce inflammation, and bring down a high temperature. The main types of NSAIDs include ibuprofen, naproxen, diclofenac, celecoxib, mefenamic acid, etoricoxib, indomethacin. High-dose aspirin. Low-dose aspirin is not normally considered to be an NSAIDs. Mechanism of action. Clopidogrel is a prodrug which is activated in 2 steps, first by the enzymes CYP2C19, CYP1A2 and CYP2B6, then by CYP2C19, CYP2C9, CYP2B6 and CYP3A. The active metabolite then specifically and irreversibly inhibits the P2Y12 subtype of ADP receptor, which is important in activation of platelets and eventual cross-linking by the protein fibrin. Dosage. Adults, 75 mg once daily. Platelet inhibition can be demonstrated 2 hours after a single dose of oral clopidogrel, but the onset of action is slow, so a loading dose of either 600 or 300 mg is administered when a rapid effect is needed. Special precautions. Patients at risk of increased bleeding from trauma, surgery, or other pathological conditions. Ulcer, renal and hepatic impairment, history of bleeding or hemostatic disorder, pregnancy. Drug interactions. Aspirin, it is also used along with acetylsalicylic acid, ASA, aspirin, for the prevention of thrombosis after placement of a coronary stent or as an alternative antiplatelet drug for people intolerant to aspirin. It is available as a fixed-dose combination. Atorvastatin reduces the increased levels of bad cholesterol, low-density lipoprotein and triglycerides, and prevents blood clots, thereby reducing the risk of heart attack, stroke and heart-related chest pain, angina. NSAIDs, risk of increased occult gastrointestinal blood loss. Phenytoin, tamoxifen, tolbutamide, warfarin, torsemide, fluvastatin, proton pump inhibitors like omeprazole or lansoprazole. Since clopidogrel inhibits CYP45 to C9, it may interfere with the metabolism of these drugs. Contraindications: hypersensitivity, active pathological bleeding, coagulation disorders. Administration within 7 days after MI and ischemic stroke. Lactation. Side effects: neutropenia, rash pruritus, abdominal comfort. Thrombotic thrombocytopenic purpura, diarrheas. Some brand names which are available in market: Clopid, Plavix, Plagril, Plavix. If you want information on a particular medicine, mention in the comment section. Thanks for watching. Please like, share, and don't forget to subscribe my channel.